Welcome to Foad and Friends, Fact and Fiction. We present the facts to you and we warn you about the fiction. We decided to start with what we call injectables, and last session we discussed the differences between fillers and toxins. We're going to discuss a different class of filler, and with me, my friend, our fellow, is Brian Bassiri. So, Brian, what are biostimulatory fillers?
So biostimulators or biostimulatory fillers are basically products that are injected under the skin that recruit collagen and help with skin rejuvenation, and I can also help with contour irregularities of the skin. Some examples include Radiesse, which is calcium hydroxyapatite, and Sculptra, which is polylactic acid. A third biostimulatory agent is a newer class. It's called Renuva, and it's derived from the extracellular fat cells. However, it does not contain fat cells itself. So a lot of times people refer to this as fat off the shelf. It's a little bit of a misnomer because it's not actually fat. However, it has all of the factors like the extracellular matrix and the different growth factors of the fat in it that helps recruit your own fat into the area. So those are the main three biostimulators.
And that is Renuva, Renuva, not to be confused with Renova, which is a type of retinol that's put on the skin, and that we'll cover some other day. So this is fact. These products work. How long do they take to work?
It's a good question. Biostimulators are a little bit of a journey. Unlike dermal fillers like hyaluronic acid, which take place instantly and you can see the results immediately after injections, biostimulators take weeks and months to take place for it to have its final outcome. So for example, Radiesse you might see in about 4 to 6 weeks, may or may not have to be repeated. Sculptra, you would have to wait at least 4 to 6 weeks and requires at least 2 to 3 different sessions spaced out about a month or so apart. And that depends on the area that's being injected. Renuva, it depends on where you're injecting it, but you may find the final outcome in one session that takes its final outcome in about 4 to 6 weeks. And it depends on which area you're placing in terms of how much fat you want to fill in that area. So a common place for Renuva is in the face. If you don't want to have constantly fillers injected every year or every so often, the fat cells will be recruited into the area, and that will be a permanent result because it's your own fat.
Now, how long do they last?
It's a good question also. So again, it depends on the volume that you put and how much you're putting it in. For Renuva, for example, if you're putting it in an area that does not have fat to begin with, it's really hard to recruit fat there in the first place. And so in areas of high shear, areas where there's not enough fat to be brought in, it's going to be hard for the body to recruit. However, on the other hand, if you're putting Renuva in areas like the buttock or the abdomen to fill in some contour irregularities where there's enough subcutaneous tissue and some fat around it, then it'll be a little bit easier to recruit and will last a little bit longer.
Let's talk about the areas where these are commonly used. We talk about the chest, the area between the breasts that is called the décolleté area. Some of these biostimulatory fillers have been placed in thinning skin around the upper arms. Some have been applied to the thighs and buttocks to improve skin elasticity and to improve on contour.
Exactly right. And Radiesse, for example, is a biostimulator that's used for the décolleté, can be used to enhance the jawline, and can accentuate certain features of the face. Most notably, it can also be used for hand rejuvenation. So the back of the hands is an early telltale sign of aging, and that's on label for rejuvenation of the hand. Sculptra similarly can be used in certain areas of the face to enhance certain features of the face. Off-label Sculptra can be used to enhance certain body areas. For example, what's known as the non-surgical BBL. If you put enough Sculptra in a certain area of the buttocks, it can potentially enhance and augment the area. However, you would need a considerable amount of Sculptra for that. And lastly, for Renuva, like I mentioned earlier, there are certain areas of the face that you can fill in with that biostimulatory Renuva. For example, cheeks, temples, and certain areas of the jawline also. And in small quantities can be used in contour irregularities on the body, like the breast, abdomen, buttock. You would need a lot to use for a non-surgical BBL for Renuva.
As with all procedures, cosmetic procedures, surgical procedures, find a provider who A, is qualified to inject that product, and B, has sufficient experience to know exactly how much to place. With some of the products, especially Radiesse, the dilution is what's important depending on which areas of the body it is being injected. So that's all for today. We'll be back with you again very soon. Thank you for joining us at Foad and Friends, where we separate fact from fiction.
And if you like today's episode, please comment, share, and subscribe to our channel. Thank you.